Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining a Collegial Conversation with Diana Clark. Today, our guest is Dr. Elizabeth Cohen. Dr. Cohen, also known as the Divorce Doctor, is a clinical psychologist and the author of The Light at the Other Side of Divorce, Discover the New You. She is the CEO and founder of the online divorce course and membership, Afterglow, The Light at the Other Side of Divorce, and Dr. Cohen is the CEO of the Center for CBT in New York City, where her online courses teach women how to heal, grow, and thrive after divorce. Dr. Cohen is joining Diana today to discuss a hidden issue amongst many, and that is high-functioning anxiety. I am now going to pass over the conversation. Thank you so much for joining us, Dr. Cohen.
Oh, thanks so much, Laura, for having me.
Of course.
And thank you. I appreciate you coming. I saw an article where you were interviewed about high functioning anxiety. And since this is my own little curiosity show, I was like, I really want to talk about that. So here you are, and I'm thrilled. So let's talk about the concept of anxiety. What is anxiety? And then how can it be high functioning? And how can it be derailing?
Great question. So let's talk a little bit about anxiety in general. So anxiety, the way I practice, is both a mind, heart, and body experience. So people often say, I'm so stressed or I'm so anxious, and they use these kind of global words to describe their experience. But really, anxiety is a physiological experience of overwhelm, of a feeling of needing to flee or get help, a desire to manage or control something. It is really the response when something overwhelming happens. Now, we need anxiety. I live in New York City. If you didn't have anxiety, I wouldn't look both ways before I cross the street. I get flattened by a truck. So anxiety is a very evolutionarily adaptive emotion. So it's really important to have it. It's when it starts getting really intensely interfering with our lives that it becomes a problem. But I always start with clients and explain to them that anxiety is really important for survival. And I think what happens with high functioning anxiety is that we live in a culture that is so linear, and it is so based, right, on like a linear ambition, linear motivation, one kind of learning. And perfectionism and high performance gets so rewarded. And very often I find that anxiety is actually underneath that ultra performance. And the person isn't even necessarily enjoying what they're doing, but they're feeling things like compelled, obsessed, like this need to do it. And to me as a therapist, those words always ring of something dysfunctional, not functional.
I remember back in my youth, I was an attorney in my first career iteration, and I felt, and I could actually imagine this after many years of therapy, that my anxiety was a dog nipping at my heels to saying, do more, be more, don't pay attention to yourself.
Oh my gosh. Yes. Such a beautiful example and metaphor. And I think especially for women, and people from other systemically oppressed groups who need to do above and beyond to be equal to another group, there is this pressure of what more can you do? We say the brain is, Teflon to good things and Velcro to bad, right? So it's like, okay, who cares that you just got that raise? What's next? Or who cares that you just nailed that presentation? What do you have? What's on my to-do list next? And that is, the chronicity of living like that impacts you deeply. It impacts your family and friends. It impacts we know now that illnesses are related to hyperanxiety. We really need to do some radical work, though. I assume you've done that. Like you said, you shifted your career, like some radical work to push back against that.
100%, because the conveyor belt of our culture puts us on very young. And unless we're willing to say this anxiety, this lack of purpose, this feeling of deadness is not acceptable and I'm going to get off that conveyor belt.
Yeah,
Okay.
exactly. And, I think in schooling, we reinforce that conveyor belt. I mean, I have so many clients who are in their early 20s, first job, and, they make a mistake because we all make mistakes. And because their history has always been straight A's and doing perfectly, they don't know how to handle it. And they really fall apart and feel like they're a failure, because you see what ends up happening is you start equating your worth to what you create and what you put out there. And we know as therapists that your worth is always there, innately within you, having nothing to do with what you actually create. But it gets mixed up. And then if you don't do well, you feel like you're a failure.
Right. And that's when anxiety becomes debilitating at that, because anxiety mixed with failure or a perception of failure makes people stall, is what I see.
Yes. And do you see, Diane, I always see the sister of anxiety, which is avoidance. Because you're so
speaking my language.
Yeah, exactly.
So I'm like, oh no.
Right. It's like, so I'm so anxious about this, I'm just not going to do it. And then that avoidance, I always say to clients, like, we can manage the anxiety. The avoidance is really what gets you derailed, because it's very hard once you start avoiding. And we all can relate to this during COVID. It's like, I used to have social skills, and now that I was forced to not, I don't know if I have them anymore. Right?
So I avoid people. Right.
Exactly.
So I avoid social situations. Yes.
Right. So then I don't get to practice being perfectly imperfect in a social situation. So then the next time I go, it feels even harder.
Right.
Avoidance is really what keeps us in these negative thought patterns and nervous system patterns, because we don't see that life is full of mistakes. Like we don't become lighthearted about it.
Right. Right. I remember reading Winnicott's work when I was in graduate school, and the coin "good enough mothering" has resonated with me. I am a good enough housekeeper. I am a good enough therapist. I am a good enough mate, because I really do believe that the quest for perfection can only lead us to unhealthy anxiety.
I couldn't agree more. And misery for us and everyone else around us, because, I also work with adolescents, and I have a lot of parents say, we don't put any pressure on our kids to do perfectly well, but they put so much pressure on themselves. And I say, when was the last time you admitted to them a mistake you made? Mm-hmm. Right? Or when was the last time at the dinner table you said, oh my God, I completely forgot to call my friend back and she's so mad. When did you share and model screwing up? And that's just what we have to do.
Right. And model coping with screwing up.
Mm-hmm.
Because I don't know about you, and I can imagine with many of your clients, when I err, it's as if the feeling of the mistake has to wash through every cell of my body. Yeah. I now can sit through it and go, okay, this is part of the wash through.
Oh, I love that. I didn't die. I lived through it. I used to love back in the day when I seeing people in person, when I would mistakenly double book people, because it was an opportunity for them to watch me make a mistake, because we all put our therapist on some pedestal, even though we're just human, and also live through it, feel uncomfortable and say, oh, what are we going to do here? I'm not sure. There's no roadmap. And in that stickiness is really where I think you grow, because life is a lot more sticky than smooth. And so we want to build, right? We want to build that muscle. And so if you're perfectionistic, you're really only building one muscle to get through one system, not to get through whatever life throws you.
That's true. That is true. So I read somewhere once, I'm a big reader and I understand probably this much of what I read, and then I use it anyway.
I can totally relate.
And one of the things that stuck with me over the years was this idea that the amygdala, the center of the fight, flight, and freeze, which is what we're really talking about, When two people connect in authenticity, it calms both brains down.
Yeah. And in fact, there's a lot of research now on what they call with the vasovagal nerve, which is the nerve that actually helps with social connection, that when you are anxious, connecting to another person is like automatic anti-anxiety medication for your nervous system. And so you're bringing up such a good point, because anxiety is so isolating, but the way to heal is actually to feel connected. So when you try to pretend that nothing's wrong, I'm good, I'm fine, just need to do like another, clean the bathroom a million times over or something like that.
Right.
You're losing the opportunity. It's not, cleaning the bathroom isn't going to make you feel better, but going to a trusted friend or parent or sib and saying, I messed up. This was really hard for me. That's what's going to heal you. So you're absolutely right. The connection is really the healer to that excited part of the nervous system.
The other thing I know, I've read over the years, is that in those families where there is a perfectionist person who is perfectionistic, driven by their anxiety, other members in the family often feel less than. Mm-hmm. And so for that person to share their humanity can actually heal not just their anxiety, but right relationships a little bit more.
Absolutely. There's nothing more uncomfortable than sitting with someone who you feel like can do no wrong. Like nobody wants to be with a perfect person. It feels pretty bad. I mean, I know some of the work that you do is substance related. And I know in my own life, a big area that I had to really become humble about was when I thought I was better than the person who was using, that I was no better. And in fact, doing that made them feel worse and might have led more to their disease. And so I think that you want to give everyone the dignity to be a full human being. And if you're only focusing on being perfect, you're not 50% of the rest of you.
Right. It's also a little boring. That's how I look at it, right? It is our imperfections that make us funny and humorous and quirky and all of those things.
Yeah. And I think as you age, it is what keeps teaching you things, because we can get very stuck on what we already know. And, if you do something a number of times, you can get good at it. But where you make mistakes is where you learn and where you grow, where you have those growing edges. Yeah. And it's so relatable to people. I mean, think about when you're, kids, when they're really little, they love, we used to, in New York City, I used to push my kids in the swing, and then I would pretend that like I didn't get away fast enough and they bumped into me.
100%.
Oh my gosh, they love that, right? This like shock of someone literally making a mistake. It's funny, it's light. And as you were saying so beautifully, it gives them permission to be imperfect. It like lays down the red carpet. Be whoever you want to be. We're all just human here.
Or as Wavy Gravy would say, we're all bozos on this bus, for those of you who remember that.
I love that.
So can we switch and talk a little bit about your work with women and post-divorce and thriving?
Sure.
To hear more about that. Can you talk about that?
Yeah, of course. So this came from my clinical experience and also my personal experience. When I was going through a divorce about 12 years ago, I had a 6-month-old and a 2-year-old, and I Googled divorce recovery and I couldn't find anything. And I realized, oh gosh, that was sending me the message that I wasn't going to recover. Like all the stigma that in 2022 is still there, even though 50% of marriages end in divorce, 65% of second and 72 of third. We still have this stigma that you're broken, it's a failure, and you're done. And I thought, hold on, I have too much clinical experience to believe that to be true. Right. So I just one step forward, 2 steps back, pulled together with the knowledge I had, some sort of recovery program for myself, and realized there was a real crucial moment for me where I realized that I could have told the story of my partner. I could have taken his inventory. It could have been, very dramatic stories, but that was leaving me feeling pretty empty. And I remember this being this is how I remember it, Central Park, and literally having two paths and thinking to myself, okay, I can either focus on him or I can figure out gently and compassionately, how did I get here? And what can I do for it to be different next time? And that's when I turned towards me and did all this healing work. And I'm grateful now for the divorce and our experience together, because I don't think I ever would have healed all this stuff that had nothing to do with him.
So that's what I was going to say. When we get divorced or when we're grieving a loss, other unfinished business comes to the fore.
Oh,
right?
yeah.
And we
I love that. I love that phrase. I think it's from 12 Steps. When you're hysterical, it's historical.
Ooh, I've not heard that.
Yeah. So like when things get all, sure, what's happening with your ex is painful. Of course, there's grief, but it was all a recreation of old grief that I hadn't processed. And so I realized I can only control myself and I can do all this growing. And look, I always say like this is related to perfectionism, another painful growth opportunity. Like when things get difficult, they really are growth opportunities.
Right. I usually add an F-bomb in front of
Me
the
too.
opportunity, because I do know at this age in my life, I'm presented again. And if you don't learn it once, it will be presented again and again. That's the deal.
You're absolutely right. Such a good point. Like you can resist it and try to control it, but you're totally right. It'll come up again. And sometimes I need to learn the lesson. I'm like, here's that lesson again. And every time you get just a touch, a molecule better at doing it, because we're talking about tiny changes throughout the lifetime. We're not talking about huge, huge shifts. I believe, life is about accumulation of small moments.
I recommend to families who work with people who have loved ones with, major mental health concerns, or where the process of change is going to be glacially small and slow, that they buy a jar and put in pebbles or marbles so that each time there is a change, they can see it, because we're so famous for not seeing it. And we're so famous for not embedding change.
Oh yeah, that's a great idea. I'll share that with some of my clients too. That's really great, because also I feel like with my clients, it's like even if you have the jar of pebbles, like one day they don't put the pebble and you throw the whole pebble thing out. You've never done this, right?
Not good enough.
Not exactly. And it's really, and we want people, I always think about, can I be as patient with myself as I would be with a little baby or with a dog? Like, what if we brought that patience and love and understanding? If your dog pees on the rug, you don't send them back. You clean up, you give them a hug, and you move on. What if you could teach them? What if you treated yourself that way?
That'd be nice.
I know.
It would short circuit the washing of the cells. Which takes much longer than that.
It really does. It really, and I think the compassion on the other side is humility. If we allow ourselves to make mistakes and we see mistakes as part of a growth opportunity, then we can be humble. And I don't know about you, but I certainly feel like this world could use so much more humility.
Yeah, that's a great place to end. Do you have any other magic wand? If you had a magic wand, what would you see? What would you do with it?
I think I would try to help people shed their carried traumas that are really blocking them from their true capacity. I think if we were all able to connect to our true capacity and believe in ourselves, the world would be an unbelievable place.
I love that. Thank you, Dr. Cohen. I appreciate you joining me. This was delightful.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.